Hi everyone. So for today, our topic in pharmacology is about inflammatory and immunologic drugs. So first and foremost, let us have a very brief review of what inflammation is. Inflammation is actually a reaction to any tissue injury. And whenever our body senses that there is an injury, there's a release of chemical mediators. And this inflammation may result from infection, trauma, surgery, pwede ring extreme heat or cold, or sometimes caustic chemicals also. Now, all chemical mediators, once they are released, they increase capillary permeability. Ano ba itong mga chemical mediators na ito? One is histamines. Aside from capillary permeability increase, nagkukos din siya ng vasodilation. Another is bradykinins. Aside from increasing capillary permeability, bradykinins are also responsible for pain. Another, prostaglandins. Yung prostaglandins naman, again, aside from increasing capillary permeability, responsible din sila sa vasodilation, pain, and also fever. Now, these responses to tissue injury will now lead to the development of the five signs of inflammation. So, kung natatandaan nyo yung five signs of inflammation, we have rubor, dolor, calor, tumor, and functionalisa. So, pag merong inflammation, may rubor, may redness. Pag may inflammation, minsan nakakaramdam din tayo ng dolor. There is pain. There is calor. When you touch the body part, merong warmth or heat na mararamdaman. Merong tumor, which is actually the swelling na mamaga. And lastly, yung loss of function or functionalisa. So yun yung five signs of inflammation in response to the tissue injury. Now, itong mga anti-inflammatory drugs, specifically the NSAIDs or the non-steroidal anti-inflammatory drugs and steroids, they inhibit these chemical mediators. Thus, they increase the inflammatory process. All right? So, let us now first go to the first group of drugs which deals with pain as an unpleasant sensory and emotional experience. And these drugs are generally called analgesics. So pag kayo ay may nararamdamang masakit sa katawan, it's usually associated with actual or potential tissue damage or described in terms of such damage. Now let us try to know two important concepts when we talk about pain. Yung pain threshold, yan yung level ng stimulus you need to create a painful sensation. Yung pain tolerance naman, it's the amount of pain a person can endure without having to interfere with normal functioning. Ang mga iba-ibang tao, iba-iba ang level ng pain threshold. What may be painful to me may not be painful to someone else. So for example, client A and client B. Si client A at si client B, tinusok mo ng karayom, yung karayom parehong size, parehong gauge, no? Pareho din naman yung binigay mo na gamot, even the dosage, for example, pareho siya, no? Pero yung pain threshold ni client A, mababa. Kaya nung in-inject mo sa kanya yung gamot using the same exact needle and syringe, nasaktan agad siya. Naiyak siya sa sobrang sakit. Pero yung client B, na mataas yung pain threshold, kahit na the same yung pagkakatusok mo, the same lahat from client A, siya, wala man lang siyang naramdaman kasi mataas yung pain threshold niya. So, iba-iba yan sa iba-ibang tao. That's why for different persons, no, natatawag natin, na describe natin minsan yung pain is relative. What may be painful to someone else may not be painful to another person, even if it's the same characteristic, the same intensity ng type ng injury. Okay? Another is pain tolerance. Si pain tolerance naman, nararamdaman mo yung pain. Alam mong may masakit, pero natotolerate mo siya. Ito naman, may mga patient na ang iksi ng pain tolerance. Naramdaman niya yung pain, ito yung pain, no? Hindi na siya agad maka-function. Okay? Meron namang mga patients or meron namang mga tao na nararamdaman yung pain pero kinakaya niya, natotolerate niya. Okay? So, people also have different pain tolerance levels. Alright? There are also different kinds of pain, no? Pag acute pain, usually ito yung merong very recent injury, na-aksidente ka, nauntog ka, naipit yung kamay mo, okay? Post-operative, inoperahan ka, and yung mga flares, inaatake, no, ng sakit. Yung chronic pain, usually it involves long-term. Nociceptive, ito yung mga sakit usually caused by inflammatory diseases. Neuropathic, may kinalaman sa nervous system. Central involves the brain and the spinal cord. Peripheral involves the nerves. Yung visceral naman, yung mga nararamdaman mong sakit sa loob ng katawan. Usually, the organs, no, the internal organs, and mixed would involve sakit ng likod mo, cancer pain, or muscle pain. Alright? Nociceptive pain, pwede rin natin dyang isama pala, by the way, yung mga burns, no? Pag nasunog ka. Okay? Yung visceral pain naman, pwede dyan din yung, sabi ko nga, mga internal organs, no? Yung may nararamdaman ka na hypochondriasis. Okay? Now, nurses should first accept that there is pain in your patient para matulungan mo siya dun sa nararamdaman niyang painful sensation. Ang una mong dapat gawin, tanggapin na may nararamdamang masakit sa kanya. Hindi mo pwedeng sabihin na hindi po yan masakit because you do not feel what the patient feels. So, para matulungan mo siya and you can intervene for the pain, you first have to accept that there is pain. And after accepting that your patient is experiencing this painful situation, you have to assess. Anong klaseng pain ba yung nararamdaman niya? Anong level of pain ba yung nararamdaman niya? Maraming paraan para tayo ay mag-assess ng pain. The most commonly used is the numerical scale. Mommy, on a level of 0 to 10, 0 po yung walang pain, 10 yung pinakamasakit. I-describe nyo nga po sa akin yung level ng pain na meron ka from 0 to 10. That's actually the easiest and the most commonly used assessment tool for pain. Another is yung verbal descriptor scale. Mami, pakipaliwanag mo nga sa akin kung anong klaseng pain ang nararamdaman mo. Is it worst, severe, moderate, mild, or no pain? Yun namang Wong-Baker facial grimace scale, you will have to determine yung facial reaction ng patient mo. Kaya pa ba niyang ngumiti? Hindi na ba siya ngumingiti? Okay? And another way to assess pain is yung activity tolerance scale pain, which means you are gonna assess kung kumusta yung response niya sa activities of daily living in relation to the painful sensation. Meaning, halos nakahiga na lang ba siya sa kama? Bed rest na siya kasi wala siyang makilos because of the pain? Or kaya pa niya yung activities of daily living? Or normal, no pain at all. So, kaya niyang gawin yung usual na ginagawa niya. Now, these are the analgesics. So, pag meron ka ng nakitang pain dun sa patient mo, tinanggap mong may nararamdaman siyang pain, inassess mo yung pain, what's next, you have to intervene. And one way to intervene is to administer medications to the patient. Okay, some medications can be prescribed by the doctor, but of course, as nurses, we can also recommend some pain medications, pero in the hospital, maaaring dapat ay ordered siya. Okay? Now, there are two general classes of analgesics, the non-opioid and the opioid. Silang dalawa ay may mga differences. Unang pagkakaiba nila, yung potency. Non-opioid analgesics are less potent. Pwede sila for mild to moderate pain. On the other hand, yung opioid analgesics, more potent, pwede sila for moderate to severe pain. Second difference is paano mo siya mapoprocure. Non-opioid analgesics are over-the-counter drugs. So, pwede mo siyang bilhin kahit walang reseta. Pero yung opioid analgesics, they require prescription. In fact, special prescription siya nung mga doktor na meron ding license dun sa mga opioid drugs. Okay? Third, non-opioid analgesics ay hindi addicting. Pero yung opioid analgesics, they cause addiction. Which means, merong psychological and physical dependence beyond voluntary control. Usually after prolonged use of the opioid analgesic. Alright? What now are the non-opioid analgesics? So, dalawa na classification under the non-opioid, yung NSAIDs and the para-aminophenol. Ang NSAIDs, non-steroidal anti-inflammatory drug. We will further discuss them later as an anti-inflammatory drug in general. Pero dito, for purposes of determining ano yung mga pain medications, under siya sa analgesic. Okay? Aspirin is the oldest anti-inflammatory drug. It inhibits prostaglandin synthesis. Nabanggit ko kanina, prostaglandin is one chemical mediator causing pain. Okay? Ngayon, yung aspirin, it is as effective as acetaminophen to decrease fever. Okay? Magaling siya sa lagnat also, aside from pain. Alright? But, aspirin as a salicylate can also cause toxic effects, lalo na kapag lagi mo siyang ginagamit, such as what are these manifestations, no? Headache, dizziness, vertigo, tinnitus or ringing in the ears, and ang pinakadelikado doon pag may bronchospasms na. So you have to watch out also for adverse effects of aspirin. Ang tawag doon, salicylism. Okay? Ibuprofen, no? Ang pinakasikat dyan, yung Advil. Advil is an ibuprofen. It is actually the best medication recommended for women with dysmenorrhea or Mittelschmerz. Pero kung kaya nyong i-tolerate yung pain ng dysmenorrhea, better not to take medications. Alright? Yun nga lang, itong ibuprofen, no? Same with aspirin din. Kung lagi mo rin siyang tinitake, nag-i-increase yung risk ng patient sa peptic ulcer. Alright? Ang naproxen, magaling yan for muscle aches and pains. Nasa commercial, may mga commercials ng naproxen, no? Na mga nag-exercise or yung mga sports enthusiasts. Next, yung acetaminophen, Tylenol, Tempra, Biogesic. Okay? Sila, magaling din sila sa pain, pero very effective din sila sa fever, aside from that. Alright? The second group of analgesics are the opioid analgesics. So, si morphine, yan ay for severe pain, moderate to severe pain. In fact, sa sobrang severe ng pain, kaya niya yung pain, acute pain ng post-MI o kaya yung cancer pain. Alright? Yun nga lang, itong mga opioid analgesics, they really cause respiratory depression. That's why if you are taking or if you are giving these drugs to your patient, you should always check the respiratory rate. RR ang pinaka-importanting chine-check pag nagbibigay ng opioid analgesics kasi pwedeng nagbabradip niya na sila because of decreased RR. Wala na silang nararamdaman eh. Yun pala, hindi na rin sila halos humihinga. Alright? Meperidine or Demerol has a shorter duration of action than morphine. Mas mahaba yung duration of action ng morphine kaysa meperidine. Sa buntis, no, preferred ang meperidine kaysa morphine. Not buntis, but people or women who are actually giving birth, yung nanganganak na. Bakit mas preferred ang meperidine kaysa sa morphine sa nagle-labor? Because it does not diminish uterine contractions and it also causes less neonatal depression. Alright? Ang mga gamot na ito din ay best to take even before the pain becomes severe. Alam mo na pwede siyang maka-experience ng severe pain. Huwag mong intayin na severe na yung pain bago mo siya ibigay. Sige mami, hanggat kaya mong tiisin. Mamaya ka na bibigyan ng pain meds. No. Alright? Hydromorphone, no? It is 6 times more potent than morphine. Okay? So again, sa dalawang yan, no, non-opioid and opioid analgesics, yung opioid analgesics are generally addicting drugs. In fact, sa statistics, pinakamadami na addict sa opioid ay mga healthcare professionals, especially nurses. Why? They have the easiest access to get morphine. Mahirap kasi siyang ma-procure eh. At sino yung mga madaling makaprocure niyan? Yung mga merong, yung mga nasa healthcare profession. Alright? Now, because opioid analgesics are addicting, may mga patients na addict dyan, no? Of course, and maybe these patients, lalo na kung ako ay may chronic cancer, for example, and I'm taking morphine, I need to take morphine, otherwise I would feel the severe pain and would affect my living. So, pwedeng binibigyan ka talaga ng morphine. To make sure that the patient does not develop addiction, does not become dependent on the opioid, may mga paraan. One is the methadone treatment program. Methadone replaces an opioid, but it causes less dependency than the other opioids. Especially kasi when you discontinue the opioids, no? Withdrawal symptoms and rebound pain may occur. Pag sinabing rebound pain, nagkaroon ka bigla ng temporary increase in pain kahit wala naman talaga. Siyempre, ayaw natin yung withdrawal symptoms. It affects the nervous system. Ayaw natin yung rebound pain. Alright? So, para ma-treat yung mga patients na nagiging addicted sa opioid, methadone is one method. Another is opioid agonist antagonists, medications in which an opioid antagonist is added to an opioid agonist. This will decrease opioid abuse. At yun yung nalbuphine or Nubain at saka yung pentazocine. Now, what are the antidotes for overdoses of natural and synthetic opioid? It has a higher affinity to the opioid receptor site than the opioid being taken. So it blocks the receptor and inhibits the opioid action. Naloxone and naltrexone are the antidotes. When will you know that you need the antidote? I mentioned a while ago that opioid analgesics cause respiratory depression. So you have to check RR. Kapag bumababa masyado yung RR, that's when you need an antagonist already. Na-overdose na siya, sobra-sobra na yung opioid, kaya nagkakaroon na siya ng respiratory depression. Okay? Naloxone may cause tremors, so we can teach or inform patients of those side effects. Okay? Now, let's go to these inflammatory drugs in general. Inflammation, again, as what I've said earlier, is a natural response of our body. It's a normal biological response of our body, of our tissues, to any harmful stimuli or injury, with or without infection. Pag merong infection, laging may inflammation. Pero hindi porket may inflammation ay merong infection. Okay? Kasi nga, si inflammation, any kind of injury. Madapa ka nga lang, di ba? May inflammation yon, may injury pero hindi ibig sabihin nun na may infection ka. So, sa pag-discuss natin ng inflammatory drugs, we will be dealing with the NSAIDs, number 1, steroids, number 2, and drugs for specific inflammatory diseases such as anti-rheumatic drugs and the anti-gout drugs. Let's start with the NSAIDs. Okay, kanina ang NSAID nabanggit natin na siya din ay kinoconsider na analgesic bukod sa pagiging anti-inflammatory drug. NSAIDs inhibit the enzyme COX. COX is cyclooxygenase. It's an enzyme responsible for converting arachidonic acid to prostaglandins. Okay? Therefore, pag in-inhibit mo yung COX, ini-inhibit mo rin yung synthesis or biosynthesis ng prostaglandins. That's why sometimes we term them as prostaglandin inhibitors. This synthesis of prostaglandin kasi causes inflammation and pain. So, if you inhibit them, you inhibit prostaglandin synthesis, you also inhibit the inflammation or the inflammatory process. Plus, again, it can also control fever and pain, kaya analgesic and antipyretic effects. Merong dalawang klase ng COX, COX-1 and COX-2. Si COX-1, it protects the stomach lining and regulates blood platelets. Pero yung COX-2, it's the one triggering inflammation and pain. There are 7 general groups of NSAIDs. First, yung salicylates, again, si aspirin. No? Aspirin is the oldest anti-inflammatory drug. 1899 pa lang, may aspirin na. By Adolf Bayer. Okay? Tinatawag din minsan siya na acetyl salicylic acid. Ang acronym niya yung ASA. Aspirin is well absorbed by the GIT, pero it can cause GI upset. So best to take it with food, with water, or with milk. Alright? Since GI upset is common, no, pwede rin silang bigyan ng mga enteric-coated tablets na aspirin. Meron noon. Alright? So, aside from anti-inflammatory activities, again, si aspirin ay may anti-platelet activity din. Kaya niyang magpalabnaw ng dugo. Kaya nga pwede siya sa mga patient na post-MI or post-stroke to prevent another attack. Another important thing to consider yung sa aspirin, hindi na siya binibigay sa mga bata for flu-like symptoms. Kasi nai-incorporate siya risk for having or developing Reye's syndrome. R-E-Y-E'. Yung Reye's syndrome, it's acute hepatic encephalopathy. It's fatal. Okay? Pero hindi porkit nag-take ng aspirin magkaka-Reye's syndrome. Ha? But, yung mga may Reye's syndrome, nakikitaan halos lahat na yung flu-like symptoms ng batang ito, binigyan sila ng aspirin. Kaya hindi na siya recommended for these young children. Alright? Second is the para-chlorobenzoic acid derivatives or yung mga indoles. Indomethacin is very common. Indomethacin, aside from being an NSAID, is also good for PDA. Isa siyang congenital heart defect. Patent or patent ductus arteriosus. Yun yung PDA. Alright? Binibigay siya sa mga newborn na may PDA. Patent ductus arteriosus. It's a congenital heart defect. Also, ang indomethacin ay magaling din for rheumatoid arthritis. Phenylacetic acids, diclofenac sodium, ketorolac, itong mga NSAIDs na ito, pwede niyang maging ka-level yung potency halos ng morphine. Okay? But not totally the same level. Pero kaya niya ang severe pain. In fact, kaya niya yung mga post-op pain. Okay? Si ketorolac, no? Nabanggit ko nga, kaya niya yung post-op pain. As potent as an opioid analgesic. But these drugs has little inflammatory effect. Kaya pag nakita nyo may patient na binibigyan ng diclofenac or ketorolac, usual indication yan is severe pain, but not really for the anti-inflammatory effect. It is parenteral, per orem, may ophthalmic din siya. Alright? It can also cause kidney problems lalo na kapag matagal siyang tinitake, no? So check BUN, CREA, no? Blood urea nitrogen, saka creatinine. These blood tests assess the functioning of your kidneys. Alright? Next, yung propionic acid derivatives. Sorry. So again, yan si ibuprofen, yung Advil, ketoprofen, and naproxen. Alright? Nabanggit ko na yan din kanina. Anthranylic acids or phenamates, it's very common. Mefenamic acid. It's for mild to moderate pain lang. Okay? Yung inflammation, pwede rin siya. Oxycams, piroxicam, and meloxicam are also good for pain sensation. At medyo mataas din yung potency level niya. And lastly, the newest of all the NSAIDs, yung celecoxib. Celecoxib, among all of these NSAIDs, cause the least GI distress. So, mahal din siya, no, sa mga over-the-counter drugs na pwede nyong mabili for pain. Okay? So, again, siya ay isang COX-2 inhibitor. To summarize, again, client teaching, no alcohol, no anticoagulants because these drugs have a anti-platelet property so baka lalong mag-bleed. Sa mga bata, huwag magbigay ng aspirin, baka magka-Ray's syndrome. No? Number three, tablets may cause GI distress. So give with food, milk, water. Better, pwede rin enteric-coated. Pero sa lahat ng yan, celecoxib ang may least GI distress. Number four, pag papa-opera, kailangan mo nang ihinto yung NSAID for a period of time kasi again, NSAIDs may cause the blood to become thin. So pag inoperahan ka, halimbawa, bubunutan ka ng ipin. Yung pala, 2 linggo ka nang nag-aspirin. Baka hindi huminto ang pagdurugo ng ipin mo pag binunutan ka. So, kailangan mong i-inform yung surgeon. 5, NSAIDs, no? Women who take NSAIDs may also have a heavier menstrual flow. Again, kasi nga, may blood thinning properties siya. 6, congenital anomalies may occur when taken during pregnancy, especially on the last trimester. Alright? Taking NSAIDs during pregnancy may also cause congenital heart defects for babies. And number 7, yan yung mga side effects to watch out for. At nandyan din yung tinatawag nating effects ng salicylism. Okay? So you have to stop taking the drug pag mayroong signs of salicylism. Next group of anti-inflammatory drugs are the corticosteroids. Prednisone, prednisolone, and dexamethasone are common corticosteroids, pero marami pang ibang steroids. Alright? They control inflammation by suppressing or preventing the components of the inflammatory process at the injured site. Mahaba yung half-life niya, greater than 24 hours, and administered once a day in a large prescribed dose. Alright? This drug is widely used for arthritis. But remember, these drugs are not drugs of choice for arthritis kasi marami siyang side effect. Pero madalas, effective siya at ginagamit siya sa mga arthritic flare-ups pag inaatake ng pain ng arthritis, pag inaatake ng pamamaga ng arthritis. Alright? Ang ating katawan, no, ang steroids sa ating katawan, naturally, mataas in the morning. Alright? Cortisol, no, from the word corticosteroid. Cortisol is a natural hormone of the body secreted by the adrenal cortex. At may kinalaman siya sa metabolism. Very important siya. Normally, mataas ang cortisol natin sa umaga. Kasi diurnal ang karakteristik ng cortisol. Pagising mo ng umaga, mataas siya, mamayang gabi, bababa siya. And because corticosteroids somehow mimic cortisol, kailangan sundan rin natin yung natural rhythm niya sa katawan. So because you take it once a day, it's best to teach patients to take steroids in the morning. Kasi naturally, cortisol is high in the morning. And because steroid is a form of cortisol, just its function is similar to what cortisol does, gagayahin mo yung natural rhythm niya sa katawan. Okay? Taper the drug. Pag sinabing taper, bago mo i-stop yung drug, you have to lower the doses first. Unti-unting bababaan yung dose bago totally ihinto yung drug therapy. Alright? Next group of drugs are drugs which we call DMARDs or DMARDs, no? Disease-modifying anti-rheumatic drugs. Alright? And one is an anti-rheumatic drug for rheumatoid arthritis. Well, hindi nyo pa alam yung pinaka-konsepto ng RA o ng mga sakit na dinidiscuss ulit natin dito, no? Pero I'm giving you brief introduction of these drugs which you will further understand sa med-surg topics nyo. So, ano ba yung rheumatoid arthritis? Chronic siya, systemic disease, inflamed. So, ibig sabihin, may namamaga, no? May namumula, may masakit. The signs of inflammation, rubor, dolor, tumor, calor, functionalisa. Okay? May inflammation saan? Joints and related structures. Bakit? Kasi may inflamed synovial membrane. Going back to anatomy, yung synovium, no, synovial membrane, meron yan yung ating mga joints to allow movement. Okay? To help doon sa movement ng mga joints na movable. Alright? So, yung mga may rheuma or rheumatoid arthritis, madalas symmetrical. Meron sa kanang tuhod, meron din sa kaliwa. Okay? As you can see in the photo. Now, these are the anti-rheumatic drugs. Alright? Gold. It's also called chrysotherapy or heavy metal therapy. It arrests progression of RA and prevents deformities by depressing migration of leukocytes or white blood cells and suppresses prostaglandin activity. Again, ano yung sabi natin sa prostaglandin? Isa siyang chemical mediator which allows pain to happen. Leukocytes are white blood cells and white blood cells are responsible for inflammation. Kaya meron ng 5 signs of inflammation din. Alright? Gold is actually not used in the early stages of disease unless RA is progressing rapidly. And if RA is not responding to other drugs, such as yung mga NSAIDs kanina. I'm sure meron kayong mga lolo, lola, no, na nirarayuma. Ano ba yung madalas na binibigay sa kanila pag inaatake yung rayuma? Madalas yung mga NSAIDs, Advil, no? Tylenol, pwede yon, okay? Gold, no, again, is given if unresponsive nga dun sa therapy na yon. It is not used in far advanced arthritis, alright? It's only for palliative, meaning for the symptoms to be relieved. It is not curative. Alright? Its response is to alleviate the symptoms, pero mabagal. Mabagal siya. No? Usually, ini-inject siya in 2 months. No? Pag naman oral, 3 to 6 months, ganun yung effect niya. Half-life is very long, 7 to 25 days. And it is also highly protein-bound. Kaya nga hindi siya yung unang-unang choice mo pag merong arthritis o rheuma yung isang patient. Okay? It can also cause blood dyscrasias, such as a granulocytosis, destruction ng granulocytes, yung white blood cells. It can also cause aplastic anemia. So, pag nagbigay ng gold, check mo yung skin cavity, oral cavity, baka dinudugo na. Watch out for blood in urine. Okay? Sa lahat ng gamot na nandiyan, auranofin lang yung oral. Si gold, sodium, thiomalate, tsaka yung aurothioglucose, sila ay parehong injection. Again, yung injection may take 2 months to be effective. Yung oral, mas matagal, in 3 to 6 months. Alright? Next are the immunosuppressive agents. It's primarily used to suppress cancer growth and proliferation. But, pwede siya sa refractory RA. Ano yung refractory RA? Again, ito yung RA na hindi nagre-respond sa anti-inflammatory drugs. Alright? Such as yung una kanina, yung NSAIDs. In low doses, pwede siya doon. Pero in high doses, pwede siya sa cancer. Uh, kung kaya niya ang cancer, kaya din niya yung inflammation. Alright? Azathioprine, cyclophosphamide, and methotrexate are cancer drugs. But then again, in low doses, immunosuppressive agent siya. Only for refractory RA. Third are the immunomodulators. Okay sila for moderate to severe RA. They disrupt inflammatory process and they actually delay the disease progression. Si interleukin receptor antagonist siya si anakinra. Ang interleukin, it's a cytokine. And this cytokine contributes to synovial inflammation and joint destruction. That's why when you inhibit them or antagonize them, nadidisrupt yung inflammatory process ng RA. Anakinra is given subcutaneously. Ang peak time niya nasa 3 to 7 hours. Ang half-life niya 6 hours. Alright? Yung TNF naman, tumor necrosis factor, TNF blockers. Ano ba yung tumor necrosis factor? TNF again contributes to synovitis. Yung inflammation ng synovial membrane kung saan nandoon yung site ng rheumatoid arthritis. So, when you block TNF, you also delay the disease process. Ang mga gamot naman na ito, lalo na yung Arava, medyo nagkukos ng dizziness, medyo nakakahilo. So again, pag may mga ganon na effect yung gamot sa patient, we teach them to prevent activities that require mental alertness. Pagdadrive, okay, kasi nga it can cause dizziness or headache. Delikado siya for the patient. Next group of inflammatory drugs are drugs for gout. These are the anti-gout drugs. Alright? Again, to briefly introduce gout, isa siyang inflammatory condition that also attacks joints. Parang yung rheumatoid arthritis. No? Pero dito sa anti-gout or dito sa gout, the usual site is the big toe. Yung nasa photo. Alright? Noong unang panahon, tawag sa gout disease of the kings because in the past, no, royalty eats rich foods, they drink wine, they drink alcohol, and then they suffer from gout. Tinatawag din siya noon na unwalkable disease kasi pag may acute attack yung gout, nahihirapan talagang maglakad yung mga patient na nandoon sa period ng attack ng gout. Alright? Si gout, characterized siya by uric acid metabolism disorder and defect in purine metabolism. Purine is a product of protein. Okay? Na iba doon sa dahilan kung bakit merong RA. Pero rheumatoid arthritis and gout, no, yung dalawang sakit na yan, they both affect the joints which cause really moderate to severe pain once may attack. Pero again, magkaiba yung dahilan kung bakit merong inflammation ng joints. So dito nga kay gout, dahil sa pagtaas ng uric acid, kasi hindi ma-metabolize yung purine as a product of protein. Dahil dyan, tumataas yung urates, yun yung uric acid salts, nag-accumulate siya, hyperuricemia, sa dugo. And nagkakaroon ng ineffective clearance ng kidneys or sa kidneys. Okay? Anyway, you will further discuss this sa med-surg topics nyo. So again, ang goal natin dito, yung gamot for the inflammation. So ano yung mga gamot for gout? The anti-inflammatory gout drug is colchicine. Colchicine inhibits migration of leukocytes at the inflamed site. Leukocytes are white blood cells responsible for inflammation. So, pag ininhibit mo yung pagpunta ng leukocyte dun sa site of injury, wala yung WBC na responsible sa dolor, tumor, calor, functionalisa, rubor, etc. Alright? Colchicine is the first drug for gout and it is the best drug for a gout attack. It's very effective to alleviate acute symptoms but not in other inflammatory diseases. Colchicine is also only for a gout attack. Alright? Um, ang question, pwede rin ba dito yung NSAIDs na ginamit kanina doon sa rheumatoid arthritis? Pwede din naman. Advil, pwede yon. Pero best recommended ang colchicine during a gout attack. It causes GI upset, so take it with food. It's also well absorbed in the GI tract. Ang peak time niya, no, kapag may gout attack, sumasakit, 2 hours. It is also mostly excreted in the feces. Alright, so madalas nating naririnig ang excretion ng gamot ay kidney. Colchicine is one drug mainly excreted in the feces. Hindi pwedeng gamitin kasi ang colchicine sa mga patient na may renal problem. Alright? Yung pangalawa, yung uric acid inhibitor na allopurinol. Allopurinol inhibits the final steps of uric acid biosynthesis. Ibig sabihin, pinapababa niya yung blood level ng uric acid or the serum uric acid. Therefore, it is not effective during an attack. Effective siya to prevent an attack, which is a prophylaxis. So, pag umaatake yung gout, colchicine. Acute attack, colchicine. To prevent attacks, maintenance dose, allopurinol. Allopurinol, no, is also okay naman if with renal problems. Unlike yung colchicine, hindi siya recommended kung may renal problem yung patient. Increase also oral fluid intake for diuresis to occur, mabilis ma-eliminate with allopurinol. At hindi mag-develop ng crystals in the urine. Third are uricosurics, such as probenecid and sulfenpyrazone. They increase uric acid excretion. Okay? Probenecid or both of these drugs, they both inhibit reabsorption of uric acid. Kaya mas effective siya sa pag-alleviate ng chronic gout. Pero hindi siya okay for acute gout. Again, acute gout, colchicine. But, okay siyang i-combine with colchicine, no, for best results. Una, small doses of colchicine muna before adding probenecid. Alright? Also, take into consideration, probenecid prolongs the effect of penicillin. Penicillin is a common antibacterial drug. So, pag ang patient nagtitake ng penicillin, tas may probenecid pa siya, probenecid prolongs effect of penicillin. So, it can cause overdosage or adverse effects to the patient. Okay? Yung sulfenpyrazone, it is more potent than probenecid. Pero probenecid is the first line as a uricosuric drug. Okay, so to summarize again, yung client teachings natin, watch out for the adverse effects. They are the following. Minsan sinasabi nila, no, may naralasahan silang metallic taste in the mouth. That's an adverse effect. Again, water intake increase. Avoid aspirin because aspirin can cause uric acid retention. Magpa-check lagi CBC, renal and liver. No alcohol, no caffeine. When taking allopurinol, no, do not take large doses of vitamin C. Baka magkaroon ng kidney stones. Ayaw nga natin ng calculi. Number 7, do not ingest these foods high in protein. Sila yung nagkukos ng mataas na uric acid. And number 8, it is best to take the drug with food or at mealtime. Next of the immunologic agents are special drugs for a special condition of the immune system, which is having HIV or AIDS. Okay? Si HIV is the Human Immunodeficiency Virus. Ang virus na ito ay ini-invade ang immune cells. You can be infected with HIV. It's a retrovirus. It infects our immune cells, particularly the lymphocytes, the helper T cells, or the T4 cells. Hanggang sa unti-unti, lahat ng immune cells ma-destroy na niya. Kung lahat ng immune cells mo ay halos na destroy na nung HIV, wala ka ng effective or functioning na immune system kasi unti-unti na niyang inubos, that's when you develop AIDS. Kaya meron ka ng immune deficiency or acquired immune deficiency syndrome because of the HIV. You can get this virus through sexual contact, blood products, pwede rin siyang mag-pass through the utero or through breastfeeding. Okay? Now, so this is an HIV life cycle. I'm just showing it to you, no, na mabilis ang replication niya. It copies itself to make more virus and damage more CD4 cells. So yung CD4 cell, yan yung immune cell, the helper T cells being destroyed by the HIV. Hanggang sa magkaroon ka na nga ng AIDS. That's when you develop severe deficit in cellular immune function. At kapag meron ka ng severe deficit sa immune function, napakarami mong delikadong opportunistic infection and unusual neoplasm na pwede. In fact, ito yung dahilan kung bakit namamatay yung mga taong may AIDS. Kasi nga may mga infection and neoplasm na hindi na makontrol nung immune system ng tao. Alright? Well, pag sinabing window period in 2 to 6 months, pwedeng hindi mo pa alam na meron kang HIV, no? In fact, incubation period may even reach 10 years. Pag sinabing incubation period, una, pumasok sa loob ng katawan mo yung virus. Pangalawa, nag-develop siya, nag-grow sa loob ng katawan. At pangatlo, nilabasan ka na ng symptoms. So, nag-incubate sa loob ng katawan from the moment it entered your body until you manifested the signs and symptoms of the disease or the infection. Tapos yun nga, nagkaroon ka na ng AIDS, no? And then, syempre, death. Alright? Wala pa tayong nakikitang gamot sa AIDS or HIV. Pero, may mga antiretroviral drugs, no? In the photo, you will see the general assessment findings of a person who develops AIDS, HIV/AIDS, no? Respiratory problems, nervous system problems. But then again, as I've mentioned to you, yung opportunistic infection, lalo na yung pneumonia, yung delikado, plus yung mga neoplasms. Alright? These are the antiretroviral agents. These drugs does not kill the virus. Because viruses are self-limiting, we really cannot kill them. No? Pero, ang mga gamot na ito, can help delay the progression, no? Maaaring uh, tumagal ang buhay ng patient, maaari siyang mamuhay ng normal. Okay? Nucleoside analogs block enzyme needed for viral replication. Non-nucleoside analogs compete with the binding of the enzyme at the active site. And the protease inhibitors act at the end of an HIV life cycle by inhibiting production of infectious HIV viruses or the HIV, which means these drugs will not really kill the virus, pero bumabagal at nababawasan yung replication, yung binding with a normal CD4 cell to kill it, and yung development ng HIV life cycle na i-inhibit. In that way, nagiging mas active yung functioning immune system and can help the person na ma-achieve niya pa rin yung para siyang normal na walang sakit. Pero syempre, ang mga patients na may HIV na namumuhay na almost free, no? Is not really totally free, pero sila ay religiously nagagamot, tsaka maaga pa lang na umpisahan na yung treatment nila para dito sa HIV. Okay? So, ang mga gamot na yan, ito yung side effects: nausea, vomiting, anemia, neutropenia, seizures. So, these side effects are being expressed or manifested by patients lalo na at the early course of the treatment. Okay? So, napaka-importante to promote compliance with medications. Tinuturo natin yung meticulous hand washing sa lahat naman ng viruses. Gaya ngayon, di ba? Lahat ng tao, hand wash, dapat, no? To prevent transmission of the infection. Increase fluid intake, especially when taking these drugs. Monitor the lymphocyte count. Pag tumataas yung lymphocyte level at napapabagal yung pagbaba ng lymphocyte count, nagiging successful yung administration ng gamot. That's one way for you to tell that the drug is effective. Yung lymphocyte count ng patient, pag minonitor mo, tumataas yung level niya at hindi mabilis bumababa. Okay, preventive care, spiritual support, so yun yung mga other non-physiologic interventions for a patient with HIV. Okay, the next or the last group of immunologic agents that we will discuss are vaccines. Okay, very timely din yung vaccine sa panahon na ito, lalo na iniintay natin na magkaroon na sana ng successful na COVID-19 vaccine. Okay, so as a review, no, yung immunity process, no, ang immunity may innate at may acquired. Yung innate, yan yung inborn, genetic factors, genetic characteristics. Okay? Si acquired, may dalawang klase. Yung active at yung passive. Si active, ibig sabihin yan, ikaw, sarili mong katawan, ang gumagawa ng antibodies. So, yung antibodies, yun na magfa-fight dun sa virus. Yun namang passive, binigay sa katawan mo, antibody na. Ibig sabihin, machine, pharmaceutical company, yung gumawa nung antibody. Okay? Ngayon, dalawang klase pa ulit yung under niya. Natural and artificial. So, dun muna tayo sa natural active antibody. Again, pag active, katawan mo yung gumawa ng antibody. So, ano yung natural active? Nahawa ka. For example, no? Yung exposure mo mismo dun sa infective agent. Nahawa ka kunwari ng bulutong. Nung nahawa ka ng bulutong, automatic yung katawan mo gumawa ng sariling antibody. Okay, nahawa ka dun sa kapatid mo. So, natural active antibody yon. So, mataas yung nag-develop ka ng antibody against the chickenpox virus. That's why you have a higher chances of not getting chickenpox again. Okay? Yung pangalawa naman, yung artificial active. So, pag artificial active, ito yung immunization, which means in-inject sa inyo not an antibody. Ang in-inject sa iyo ay mahinang klase ng virus, toxin ng virus, substance ng virus, or patay na virus. And nung in-inject siya sa iyo, na-detect ng katawan mo na foreign siya, nag-determine o nag-develop ka ulit ng antibody mo. Nag-inject kayong lahat recently before the lockdown, no? Yung hepatitis B vaccine, that's an artificial active acquired immunity. Kasi yung in-inject sa inyo na Hep B, that is the actual virus. Pero hindi yung buhay na active na virus. In response, yung katawan nyo nag-develop ng antibody doon. Okay? Pag naman natural passive antibody, ibinigay siya sa'yo, antibody na. At yun yung example niyan, yung binigay sa'yo ng mommy mo nung pinanganak ka. IgG is the only immunoglobulin which crosses the placenta. So, nung bagong panganak ka, may IgG ka na antibody coming from your mommy, antibody na siya, natural siyang binigay sa'yo kasi nung pinanganak ka, dumaan siya ng placenta. Yung second naman is artificial passive acquired immunity. Ibig sabihin, in-inject mismo sa'yo, antibody na. Okay? Ngayon, ang question, bakit mas common sa mga vaccines yung artificial active kesa yung artificial passive? Bakit ang hindi na lang i-inject sa atin antibody na? Bakit yung ini-inject karamihan yung mga virus? Because still, the best manufacturers of antibodies are our own bodies. No machine can ever compare to how our bodies produce antibody. Pangalawa, they are very expensive because the antibody is machine processed. So, mas mahirap, mas matagal, mas mahal. Pero merong mga gamot o may mga sakit na meron din talagang mga artificial passive acquired antibodies. Example, yung mga IVIG sa mga sakit na Kawasaki disease, which again, you will further discuss. You will discuss, or it's a lesson in your higher years. Okay? So again, ito yung vaccine, no? You administer an antigen to be able to stimulate your immune system to produce your own antibody. What are the types of vaccine? Traditional, attenuated, toxoid, conjugate, recombinant. Ano-ano yung mga yan? Pag traditional, it contains whole or just a component of the inactivated microorganism, meaning patay. Okay? Nakalagay naman sa ilalim, no, kung ano yung mga vaccine na yan. Hepatitis A, influenza vaccine, rabies vaccine. Alright? Pangalawa, attenuated. Pag attenuated, buhay, pero weakened, pinahina. Alright? So, nakalagay din dyan kung ano mga vaccine yon. Toxoids. Pag sinabing toxoid vaccine, yung in-inject sa inyo, inactivated toxin or the harmful disease-causing substance. Hindi yung mismong microorganism yung in-inject, but the harmful substance secreted or produced by that microorganism. So, example nung toxoid vaccine, yung diphtheria, tetanus vaccine. Pag conjugate vaccine naman, it's a protein or a toxoid from an unrelated organism that links to the disease-causing microorganism. So, ibang organism, pero linked siya dun sa isang microorganism na nagkakos ng sakit, and effective din siya pag nag-produce ka ng antibody doon. Alright? Nandyan din yung mga examples under it's written. And lastly, recombinant subunit vaccine. Marami or massive quantity, iba-ibang klase ng virus, no, recombinant, no, some of the genetic material of the pathogen into another cell or organism. Isa sa pinaka bagong vaccine din, yung sa human papilloma virus. It's a quadrivalent recombinant vaccine for 4 different strains of the human papilloma virus. Itong human papilloma virus ay sinasabing leading cause ng cervical cancer. So, pwede siyang ibigay sa mga babae. Itong vaccine na ito in 3 doses, which is given IM. Okay, ngayon, whenever nurses give vaccine, kailan nyo may encounter na magbigay ng vaccine? Sa mga health center. Pag kayo'y nag-duty sa community o kaya kapag kayo ay nagwe-well baby clinic, pwede rin yon, no? In the health center, you will see or you will understand or you will learn from there. Actually, ituturo sa inyo ito sa community health nursing, yung mga importanteng responsibilities when you carry vaccines, when you handle vaccines. Okay? Hindi natin i-discuss dito further yon, sa community health nursing siya. Ngayon, pag nag-inject kayo ng vaccines, make sure that wala halos side effect ito. The most common side effect is pain at the injection site. Kasi halos lahat ng vaccine injection. Yun lang, pain at the injection site. Fever may be present, pero hindi ganon kadalas. Okay? So that's it for the inflammatory and immune drugs. So again, study these drugs. You can also read the book by Key McQuiston to further add content and read further and add to whatever I have discussed in this lesson. Okay?